Hi, I'm Dr. Presley. I'm the Director of Anesthesia here at Complete Care Surgical Center. And today I'm here to talk to you a little bit about how we're unique in that we specialize in pelvic and gynecological surgeries. Here at the Surgical Center, the Department of Anesthesia really strives to go the extra mile to make sure that patient satisfaction is utmost the best. In order to achieve this, your anesthesiologist, he or her, will review your chart the day prior to your scheduled surgery. The night prior to your procedure, your anesthesiologist will give you a phone call. This phone call is really trying to get more familiar with the patient and address any concerns or questions the patient may have. And what I have found is that the phone call the night before really alleviates a lot of anxiety in patients that have concerns or fears of the unknown. It also gives the patient an opportunity to ask any questions or any concerns that the patient may have. This is a really nice time to kind of start that doctor-patient relationship. And lastly, what's nice about the phone call the night prior is that the anesthesiologist will explain his plan, and that is whether it's a regional anesthetic, a general anesthetic, or a combination thereof. The Department of Anesthesia here at Complete Care Surgical Center stresses patient satisfaction, and partly in due, and as a result, patients are sedated every single time before they enter the operating room. We will not allow any patient to enter the operating room in an anxious state. Our facility is different in the sense that in other facilities you may have 3, 2, or even 4 patients to one nurse. In our facility, it's one-on-one care. And with one-on-one care, patients' needs can be addressed in a very timely fashion. Patients don't want to experience pain or even prolonged pain. With having to care for several patients, a nurse perhaps could take several minutes to even an hour to get to the patient to address their needs. Here at the Surgical Center, by having one-on-one nursing care and your anesthesiologist on the premises in addition to your surgeon, you have a very customized, very efficient, timely manner in which your needs are addressed. Not only do we have a surgical center here, but we also have an emergency center, specifically for women. The advantages here are simple. Rather than going to a large facility and maybe seeing an ER doctor, you can come to us and see a specialized physician who specializes in women's care. The advantages are obvious. Having an emergency center, being able to see a specialist in a time-efficient manner, and in the event that you do need a procedure done perhaps, well, the admission to the surgical center is less than an hour's time. And then however long the procedure, and the quick, efficient discharge thereafter. Now let's go down to my office, the operating room. Here we are at the post-anesthesia care unit here at Complete Care Surgical Center, where you will be seen by your anesthesiologist and your surgeon prior to your selected procedure, and upon completion where you will recover. So here in OR1, this is where you'll receive either a general anesthetic, a regional anesthetic, a combination of the two, or even heavy sedation. This largely depends on the procedure being performed and also the consultation between the anesthesiologist and the surgeon. The evening before, as we had mentioned, your anesthesiologist will call you and also discuss this plan, which will be reached with the surgeon and the anesthesiologist prior to even making that phone call. And what you can also expect is after leaving here, you'll be in the recovery room where we were earlier in the video. So despite the anesthetic that's chosen, often patients fear, well, how are they going to feel in the post-operative period after their surgery? Are they going to have nausea? Are they going to have vomiting, pain, discomfort? It is us, the Department of Anesthesia, that takes this very seriously. And we treat patients very acutely, and that's what makes us different than other centers. Is it simply that it's one-on-one care, it's a very acute setting, and in the event that any of these things occur, we can address them very promptly and quickly. In some instances, patients may have had a bad experience with anesthesia. If we have knowledge of that history, we treat that by actually treating the patient before, pre-op. Before they're even exposed to the anesthetic. And often that can actually reduce the incidence of that occurrence. In the event it doesn't, then we just aggressively treat until the patient's comfortable and ready to be discharged. So if you're thinking about having one of the many procedures that we perform, please allow me to show you there is no better place than to have it done right here at Complete Care Surgical Center. We're always available for a second opinion or to answer any questions or concerns you may have. I look forward to serving you.